United States no longer has AAA credit. The national debt is in the stratosphere, bond yields are up too, and the dollar is down. The one big, beautiful bill that packs the president's entire agenda into a single piece of legislation has now passed the House. It would add trillions to the national debt. The Senate will get its shot, and the fiscal hawks there say they need major changes to cut spending. So, Rick, what's the impact of the bill? And if you had a chance to advise the Senate, what would you tell them?
First, it is a budget buster. It's going to add, perhaps up to as much as $5 trillion to the debt over the coming 10 years. It reduces revenue by making the 2017 tax bill permanent. And while 94% of Americans get a tax break under that, about a quarter of that goes to the top 1%. It's also calling for some populist measures like no taxes on tips or overtime. Some of the cuts, like to Medicaid and healthcare subsidies, will kick as many as 13 million people off of health insurance. Now, what can be done about the deficit? First of all, another issue to show how important the deficit is. Currently, we're spending about $880 billion on interest on the debt. That's more than we spend on the military in 2024, more than we spent on Medicaid, more than we spent on all non-mandatory programs outside of the military. So this is becoming a huge part of the budget. I think we're going to have to address issues such as Social Security. I have some ideas there, but I'll let my panelists chime in before we get to some specifics.
Are we whistling past the graveyard here? I mean, a sudden crisis looming?
Look, I mean, if you are looking from a working class perspective in the United States, there's plenty to be angry about with Democrats, and I support that. But if you look at this bill, this is extremely, it will hurt the working class a lot, right? We know from research that 70 million low-income and disabled Americans, their lives are safe because of Medicare and Medicaid, and now these would be cut. There would be the tax cuts would be 60% of the tax cut will go to the top 20%. As you point out, many of people would be kicked out of Medicaid. There's weird work requirements, although most Medicaid recipients still have already work, but there's this. So I would say it's kind of this, it's a tour de force of gratuitous cruelty in one way or the other. I don't have a better way to put it. I hope the working class Americans see through this. And again, I hope in the Senate they are able to cut. But yes, the whole idea was to cut all these Doge cuts and all that, and you end up adding $5 trillion to the budget with.
And well, the Doge cuts were just to offset the extending the tax. Senator Johnson, Ron Johnson of Wisconsin, said our only chance to reset to a reasonable pre-pandemic level of spending is right now with this bill. But that pre-pandemic level of spending was still $1 trillion deficit.
Yeah, no, and he did, to his credit, he did say plussed up for population growth. So that was his sort of starting point. But yeah, no, look, the bigger picture is we are whistling past the graveyard. The credit downgrade is a significant concern. Economists say that's not the canary in the coal mine. That is a lagging indicator. And what it is an indicator of is a failure of confidence, not so much concern about whether we can pay our bills, because we do have the resources to pay our bills, we just don't have the political will. And this is just a downward spiral because the refusal to make the kind of hard choices, not on the discretionary budget, but on Medicare, defense, and Social Security, the biggest drivers of the debt. And well, now interest on the debt is the biggest driver of the debt, but the refusal to make those hard choices is ingrained in our system because the hard choices hurt the current office holder, only benefit later office holders. So the incentive when you're in office, whether you're the president or Congress, is to kick the can down the road.
Yeah, I mean, I agree that those are the hard choices that have to be made most immediately. But Rick, you touched on something that I think is really key, is when we start talking about this, we start in the weeds. We start talking about Medicaid, defense spending, Homeland Security. But the threshold questions are, where are we going to get more revenues from, first and foremost? And the extension of the 2017 tax cut bill was tremendously hurtful in terms of the federal treasury, and it hurt the federal treasury in ways that benefited the most well-to-do by reducing the corporate tax rate and also the tax rate for earners or those who earn more than $400,000. So the folks who are going to have to pay for that won't be corporate America or high-income earners, but instead the less well-to-do. So we're in the weeds of the Medicaid issue. If I could just say one other thing, we're hoping that the Senate, which is supposed to be the national body, the more deliberative body, is going to fix this. It's not going to be the Senate. It's going to come down to 3 people in the Senate, and that's Lisa Murkowski, Susan Collins, and now Josh Hawley, the same as what happened in 2017 when John McCain gave his thumbs down to getting rid of the Affordable Care Act.
So President Trump is a disruptor, and one thought that I had as he took office was, well, maybe he could be the guy to actually disrupt things enough to make some of those hard calls on taxes, but
Absolutely not, because now we haven't even talked about the tariffs and how international trade. Right now, we rely on foreigners to lend a lot of those dollars that we send overseas back to the federal government to help subsidize our debt. Now, if we're going to increase the debt more while we're sending few dollars overseas, who's going to stand up and pay for the excess government spending? This is really a long-term problem that could be a ticking time bomb for our economy.
Yeah, to Dave's question about if he's a disruptor, what's surprising to me is one of Trump's priorities is to preserve funding for veterans and also Title I funding, which is for low-income schools.